I'm sure some of my Republican friends would probably be rolling their eyes when they heard that I went to a LGBT program at the Alzheimer's Association recently. It was a program sponsored by the Western Carolina chapter of the Alzheimer's Association, long name, Conversations about LGBT Older Adults, Families, and Equality, Health, and Community Services. Days earlier, of course, in North Carolina, Bruce Springsteen canceled his concert over this thing called HB2. And that particular day, the governor was backpedaling on the bill himself, now to trying to repeal it. You probably are familiar with my wonderful state of North Carolina and this bill. So, it's tough being LGBTQ. I found out the Q stands for questioning. But imagine how it's being an LBGT elder. See, we tend to isolate people in a certain segment in time, and so we look at people who are gay or lesbian, and we picture them at a certain time, in a certain place, in a certain age. But guess what? They grow old. Doesn't mean they grow straight. And so, as they age and have the same health issues and the need for long-term care, the obviously the issues are compounded. So some of the conference covers some of the resources out there. There's a national LGBT health education center, and they publish a pamphlet on coming out to your provider. Now that's important because when you come out to your provider, there's certain risk in this population. Obviously, they have higher smoking rates, probably due to stress, increased risk of suicide, increased risk of sexually transmitted diseases. So when you come out to your provider, they can truly tailor a person-centered approach to your care. There's also something called an LGBT Healthcare Bill of Rights, and it outlines the protection and rights LGBT people have in healthcare today. There's also a Gay and Lesbian Medical Association. It publishes a directory of health professionals advancing LGBT equality. So if you're looking for a provider, there's where you may want to start. And there's also something called the Human Rights Campaign Healthcare Equality Index that showcases providers who meet four main criteria that they have. And I'm proud to say one of the the health systems here in the Carolinas that I do business with, I also get my health care there. Mom gets her health care, called Novant, actually is part of this. So when you find a provider who has a great diversity program in place and providers who are sensitive to the needs of this population, they're the ones you want to migrate to. Thanks.